Back to From the Shore to Be More. My name is Ursula Postel, and I'm an oncology nurse at a local hospital in New Jersey. I want to thank the host of the show for inviting me on to talk about women's health issues and, of course, cancer. As we close out the month of October, which is Cancer Awareness Month, I am hoping that the information shared in today's session will encourage everyone to become more proactive in their health and to learn a little more about cancer prevention and awareness. Thank you for your time, and if you're ready, I'm ready. Let's go.
Yo, here we go, here we go. Here we go, here we go. Check the From the Shore to Be More show. Coming through strong with that podcast flow. Sunday afternoon at 2 to 3 p.m. slot. Got the Interstate 95 Turnpike hot. When you tune in, they don't just entertain. They come with the message that presses the brain. Those other podcasts, they seem microscopic. Cause they're the big dogs that drop the hot topics. So sure, be more dumb, you just stay ready. For DJ Boom, Shaheem, and on Demi. Put them together, there's a treacherous string. From the tri-state area to the DMV. So sit back, relax, get your Sundays on. On after morning, gone before dawn. That positive vibe that we hitting so strong. With this podcast show, you can't go wrong. So, here we go, here we go. 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 Everybody! Yes, 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 yes. And welcome, welcome, welcome once again back to this special edition of From the Shore to Be More. I am your host, the one, the only, the entertainer extraordinaire, Shaheem. Debbie will be joining us shortly. We have other guests joining in today, but most importantly, you saw in the beginning of the show, that was and I'm going to say, my little sister, Ursula. And yes, she's an oncology nurse, and she will be joining in with her special commentary later, too. So it's going to be a great show, folks. Boom, I guess will be joining us soon, folks. For right now, you have me, and like I said, it's going to be a great show, so let's get started, all right? Again, we're recognizing today not just women's health, but of course, this is being the last Sunday in October. We wanted to recognize Breast Cancer Awareness Month. Recognize, of course, the survivors and the many strides that the medical community is making in combating this issue, but also to take a moment to remember those who unfortunately didn't survive. So again, it's going to be a great show, folks. I'm glad that we chose this topic, and a lot of people have reached out to me and to the show about how happy they were that we were doing such a very important topic. First of all, and I want to say, even one of my close friends, who I don't see all the time, but I see every now and then. When I saw him recently, this week. He stopped me and congratulated me. Well, I paused for a second because I didn't know what he wanted to congratulate me about. He said, I want to congratulate you first on the show, which I thought was great because people are watching. And that's a fantastic thing for us. On Debbie and I, and boom, we want to all thank everybody. But first, he was watching the show. But secondly, he said, I want to congratulate you on doing this topic, recognizing Breast Cancer Awareness Month. Then he went on to say, and this is something I did not know, his mom had passed away from this disease. And so that told me right then and there that this was a very important topic to do. And so I'm very proud of this one, folks. But again, that is our topic for today. But I got to also remind people that last week's show, the emasculation of Black men, that was a fantastic conversation too. People. So if you missed that, you can go back and you can check it out. Yes, you can on our YouTube channel. We're streaming everywhere. So during the work week, whatever, if you're watching the kids, whatever you're doing, having your cup of coffee, you can go back and yes, listen to some of the episodes that you might have missed From the Shore to Be More. And I will also remind you to please don't forget to subscribe All right. It's been a busy week. It's been a lot going on this week, folks. Uh, in the news and social media and things. But one of the things that happened that I definitely want to recognize, and as I see the official DJ Boom about to join the conversation, one of the things that I definitely wanted to recognize was the passing of one of cinema's greats, and that was Mr. Richard Roundtree. Um, of course, known to us as Shaft, who, of course, had his height in the 70s during the great era of black exploitation films, as people call them back then. But nonetheless, people would say he was probably one of black people's first superheroes. So I wanted to recognize the passing of Mr. Richard Roundtree first and foremost. I see Boom is setting up. He must be at his usual joint for Sunday. I'm gonna give him a minute. Let me continue going on. Also, in not so good news, I wanted to recognize the mass shooting that took place this week up in Maine. These things are becoming way, way too common in our country, and it's unfortunate. It's very unfortunate. I think if you've been following the show, you know my stance on guns. I'm not going to knock which side of the argument we stand on, but I think we can all agree that it's time for a change. And I just wanted to recognize the victims of the mass shooting up in Maine. My condolences, and I'm sure all of us send our condolences to the families. Also, as you know, I say it every week, and I'm going to say it this week. We all know about the current war taking place, not just in Ukraine, but over in the Middle East. I don't bring this up to take any side of the argument. I just want to recognize, of course, our young men and women who are serving the country over there right now in the harm's way over the Middle East, including my very own youngest daughter, Trey Asia. And I'm not a religious man, but if I was, and those out there who are, I'm sure you do, pray for their safe return. So I want to recognize the young men and women keeping us safe over in this country. All right.
What's up, cousin?
What's going on, Boom? The
You know,
official DJ. Boom is in the building. What's up, cuz?
making it do what it do what it need to be done. That's all I know how to do, brother. You know me.
I see. I see. Where you at today, cuz? You back at your
Yep,
usual spot?
absolutely. Catch Kitchen and Cocktails here celebrating
There you
Scorpio
go.
season.
It is Scorpio
R&B.
season.
It is Scorpio season.
It is bug
What a,
season. If you watch the Flintstones cartoons, people already know this one. It's bug season.
absolutely. Yes, sir. Yes, sir. Yeah, I think we have to send. I think we have to send our guest invite to get on. I think.
Okay, I had to
Um,
send because shout out to Ona Nash. She's gonna be joining us for this conversation. I had to send it to her through Messenger because I
okay.
looked and I just didn't have her email. Um, but if you have her email, you can
No,
send
no.
or
Listen, that's
yeah,
how I was going to send it. So I was going to send it through Messenger. So you sent it. It's all good. We make it do what it do.
right now. Shout out to
So,
Ona Nash, and also Debbie is gonna be joining us in and out. She got back to the set, so we look forward to talking to her too.
absolutely. Yeah. I acknowledge that. Shout out to Richard Roundtree. That we lost earlier this
Yeah,
week. One of the
yeah,
pioneers in black movies.
yeah. That was a big loss. If you grew up in that era like I did, then you know how important that character Shaft was to black people back then. And of course, he went on to do other films, but that was his most important one.
Absolutely. And then, of course, the recognizing of the mass shooting up there in Maine. I understand that they found the shooter deceased.
Mm,
From what I understand, he killed himself. Um, so, something's got to change. We hearing it. I feel like we're hearing it every month, even though it's not every month. I feel like we're hearing it every month. that somebody that lost their damn mind and want to start shooting stuff up or shooting people up.
Right. And I know it's a topic that we might have touched on before, but I think we're going to revisit that and talk about it in greater detail. But yeah, again, our condolences to all the families. On a lighter note, it is Football Sunday. So shout out to all the football fans out
there. Make some noise for football.
Right.
Listen, listen, I gotta give you a shout out. I gotta give you a shout out because your Giants actually won a game. So
yeah, right. Yeah.
I said I had to put that out there. I said I gotta tell Cuz. Okay, good job. I mean, and I can't even say although it was the Redskins because the Redskins are playing great ball. I think it would behoove the Giants to keep Tyrod Taylor as their quarterback.
Yeah, I do too. And I was happy for the win, and hopefully we can get a win today. Who is Green Bay playing?
Green Bay is playing. I just saw it. I forgot. Oh, Minnesota. We're playing the Vikings today.
Oh,
It's going to be a tough game. It's division. So anytime it's a division like the Giants and the Redskins, it's going to be a tough game. So hopefully they can pull it off. I fingers crossed they pull it off. Right now, I think both of our teams have the same record at this point. So,
well, hopefully the Giants improve. We'll see.
I know we 2-4. So.
All right, folks, we're going to keep this show rolling because we have a very important topic to talk about. So we're just going to keep this thing rolling. Get on up. Now if it's your birthday, get on up. Now if it's your birthday, if it's your birthday, if it's your birthday, get on up. Now if it's your birthday, get on up. Now if it's your birthday, get on up. Now if it's your birthday, if it's your
Cuz, before I say this, are you recording the game? Okay, good. I won't tell you what the score is. All right. Happy birthday to everybody in Scorpion Land.
Yes. I got some shout outs for sure.
I have a major shout out. I cannot let this slide by. My baby is 31 today. Shout out to Diamond celebrating her birthday today. She is 31, making it do what it do when it needs to be done. That's all she know how to do. Just like her dad. Love her to death.
Happy birthday, Diamond. Happy birthday, cuz. Enjoy your day. Yeah, I got some birthday shout outs too. To my old brother, I want to shout out. I'm just going to mention 1 second, bro.
Go ahead.
To my oldest brother, shout out to my brother Gerald, who respectfully likes to also go by Abdullah. Shout out to you, bro. Happy birthday. I hope you enjoy your day. My brother works all the time. I'm hoping he took the day off so he could go ahead and enjoy his day. Well, happy birthday, bro. Enjoy your day. And also, tomorrow is my mom's birthday. So I'm going to give a big shout out to my mom. I know she's probably watching the show. Mom, love you, Beth, for everything you ever done for me. Thank you so much for life. And,
hey, auntie.
Yeah, right. So happy birthday, Mom. I'll see you soon. You already know. So those are my 2 big happy birthdays. But for those who are celebrating their birthdays today or tomorrow or just past, you also celebrate your birthday with well, if you remember old as I am, you might remember painter Bob Ross. He also is celebrating his birthday today. So shout out to him. I remember him and I was a fan. But also Gabrielle Union. I'm not even going to tell you how old Gabrielle is today, folks. I got to look that up. But shout out to Gabrielle Union. Her birthday is today. All right. So and shout out to all and everybody celebrating their birthdays today. All right. Let's keep the ball rolling, folks. Let's do that.
You know, I guess right now we should start the show.
this is going to be simple. Okay, it's Halloween, everybody. It's Halloween. I mean, plain and simple. Do I need to tell you what you need to be watching right now? You need to be watching some horror films. You need to be watching some scary movies. Now, I did watch a couple scary movies. I saw Megan. If you people heard of that movie, the movie Megan, it's about a killer doll. I'm not going to get too much into that. I also saw. I finally broke down and saw The Mill. I'm gonna be honest, and I know Boom liked the movie. My daughter recommended it. I fell asleep on it, folks. But I'm going to continue watching it today. But what this said to me, and then I'm Boom, you can jump in if you want. What this said to me is that today's horror films just aren't doing it for me. So, what I recommend people that for today, must-see TV and movies, go back to the classics, people. That's right. I'm gonna say that. I'm gonna say that.
Well, The Mill is not necessarily a horror film. It's not.
No, it's
And
not
and
necessarily a horror.
and to keep it 100 with you, I fell asleep on it too, and I finished watching it the next day. But in my defense, and I work hard, so once I lay down, listen, I don't care what is on. It could be the greatest movie ever. I'm gonna fall asleep. So
Yeah. It just wasn't my type of thing. It wasn't exactly a horror movie, in a common sense, I guess is the word I'm looking for. But I mean, it was a drama or of some sort of whatever. But I know it was recommended, but I fell asleep on it. You got to check it out, people, yourselves, and you tell me what you think. I'm sorry, folks, if you see me moving around back here. There's a lot going on. And I'm trying to stay on top of everything. But yeah, back to listen. Go back to the classics, people. I'm going to tell you that right now. The Nightmare on Elm Streets, the Friday the 13th. For me, one of my favorite all time was the movie The Thing. That was one of my favorites. Go back to the classics. I don't care if you have to go back to the original Frankenstein stuff, because right now what I'm seeing is that everything that I'm seeing has been done to death already. So it's not doing it for me. So I highly recommend people just go back to the classics for these next few days and enjoy your Halloween. That's what I'm saying. And there you have it. That's my must-see TV. All right, folks, we got a lot to talk about today, so I don't want to hold up the show too much. All right, but I'll just want to mention donations, folks. Of course, we need your donations, not necessarily to keep the show going, but to keep the show growing, folks. And right now we're running a little short, so we need your help. We need you to send your donations, please, to paypal.me / from the shore to be more. And again, folks, so we can keep this show growing. Also, while I mention that, I also have to mention this. You can contact the show, whether you want to be on the show to play one of the game shows, or you have a suggestion for a topic that you'd like to hear us talk about. You can contact the show at Instagram at From the Shore to Be More, Twitter at @2_be more, email from the shore to be more at gmail.com, or you can call the show at 732-440-9314, folks. And make it happen. And thanks to all our loyal viewers too, because we wouldn't be anywhere without you. And right now we're getting a lot of positive energy back from everybody who's been checking out the show, and we love you for it. We appreciate it. And please continue and tell a friend. Tell a friend, by the way. All right. I see we got our guests patiently waiting, so I want to start getting into this. When I asked my sister, who's going to be on shortly, to do the show, I was a little apprehensive about asking her, because I wasn't sure how she would take it. Well, she would even want to be on the show, first of all, or would she be camera shy? Because so many people that we asked to be on the show end up being a little camera shy. But for this particular topic, my sister was more than willing to jump in and give her commentary on this. And that's how much it meant to her and how passionate she is about it. So without further ado, folks, I'm going to bring in my sister Ursula Postel.
Hello, everyone. Welcome to the show. Thank you to
Hey, sis.
Hello.
It's good to see you. It's always good to see you.
Always good to see you.
First of all, I just want to thank you again. I know I thanked you 100 times. I just want to thank you again for being so willing to come on the show to talk about this important topic. You and I were talking briefly about an hour or so ago about some of the things we were going to talk about on the show, and the conversation was starting to get deep, wasn't it?
Yeah, actually, it was. It really was. Well, anytime you talk about cancer and the importance of prevention, awareness, and people being able to advocate for themselves, and just simply about being proactive with their healthcare, that is very special to me. Being an oncology nurse, it's so sad when things could have been prevented if people just had information or access,
Right.
regarding healthcare. So that's what's important. I'm
Right.
sorry, I'm moving around. I'm trying to get comfortable.
No, yeah, please get comfortable because we want you to stay. We want you to stay for a while, obviously. So please get comfortable. Yeah,
Also,
yeah, yeah,
I gotta chime in and say, what's up, cuz?
Hey,
yeah.
how are you? Good to see you.
It's always a
Yeah.
pleasure. I don't get to see you that often. So, you know, it is what it is at the end of the day. As you know, I'm always doing something.
Understood. Understood. Same here.
Now, sis, as an oncology nurse, I'm sure you've seen a lot working at the hospital. And you even said yourself that a lot of the things probably could have been prevented.
Mhm.
What are some ways that women can prevent having some of these at least some of these health issues that we're seeing in health, especially in the Black community? Because my understanding, there are certain things that just affect African women. I think you brought it up differently, and maybe Latino women differently, and maybe Caucasian women differently.
Mhm.
So for those things that affect African American women, how can women best protect themselves?
Okay, since we're talking about cancer primarily, if I
Okay.
may,
Yeah.
I do want to say that cancer affects everyone equally. It has no name, it has no face. But for the purpose of the show and
Mm,
our focusing primarily on African American women, there are some things that we are genetically predisposed to. So it's important to know your family history. And unfortunately, in our
that's
community, a lot of that does not happen just because there is not a lot of sharing. But if you don't know your history, it's just important to be proactive about your own healthcare so you can
right.
establish your history and be able to
Right.
share it with your children so that they have an awareness. But what's most important is to understand that no one has a responsibility for your healthcare more than you do. So
Of
do not
course.
have an expectation that a doctor is going to magically go find you or find out what's wrong with you. You have to keep track of your own health care. And just when you see even commercials on television about cancer screenings or a cancer walk, show up, participate, become involved.
Right.
Because the most that you will get out of it is information, and knowledge is
Right.
power. The best way,
Knowledge is key.
I'm sorry.
Knowledge is king. Knowledge is king.
Absolutely. The
Yeah.
best way to make a well-informed decision is to have information. And you can't get that information in a day or two. So just over the course of your life, get involved. There are cancer walks throughout the year, a lot more in the fall, but especially in October, but even
Right.
throughout the year, get involved, learn about it. It may not affect you. It may affect someone that you know or someone that you love. But one of the things that we discussed earlier on was how we can prevent some of these things. And I did share with you that not
Yeah.
everything is preventable, especially if you are genetically predisposed to it.
Right. Right.
But if you know it and you are proactive with your health care and getting your annual screenings, there's
Mm.
catch early. And if you catch these things early, you have a better chance of working with your healthcare team to maybe not cure, but at least put you in a place where you still have quality of life.
Oh wow. Well
That's the
said.
important thing. That's the goal. Quality of life is the goal. Wellness
Right.
is the goal, and that is a different thing for each individual person.
Right. Well said, sis. Well said. I mean, you made some good, valid points. Now, the annual exams is very important. I know my wife, gosh, she must go twice a year. Let me tell you, she stays on top of it because I know one reason. And shout out to her mom. And people heard me say this. Her mom had a bout with breast cancer, and it got very serious. Luckily, she's still here with us today. But my wife is very diligent in making sure she goes to their exams. So let me ask you a question, though. I know with men, especially black men, we're very apprehensive a lot of time about going to our doctors, and not just going to our doctors, but even opening up about what's actually going on with us. Do black women have that same issue?
People have that issue. Yes,
Oh,
have that issue. Black women have that issue. Unfortunately, what is seen a lot of times in healthcare is that when people come in for treatment, they want you to resolve the symptom that is happening at the moment. And when that symptom or that pain has been resolved, they kind of go on and move on. But you have to understand that it's important to, even if you resolve the immediate pain or symptom, it is important to find out its origin. It may be something important, it may not be anything. And one thing I do want to share, please do not rely on google.com or to diagnose or treat anything. I'm not saying that there is not a wealth of good information on the internet, but I am saying if you don't know how to interpret and use or apply that information, you could actually do more harm than good. And especially if we're talking about cancer, any delay is not good. Any delay is not good at all. Prompt treatment and diagnoses. And in order to be diagnosed, you have to be tested. I don't know of a test on google.com that has helped anyone.
Okay. All right. See, now I'm smiling, folks, because we got into this conversation because I explained to my sister that for me, if something comes up, before I call my doctor, one of the first things that I do is I Google it. And so we had that debate because I thought I found things on the internet that actually helped me. So I was a little surprised to hear my sister say that.
I'm a little tickled because I don't know that it was a debate. You did share that. I did not debate. I simply said, stop doing that.
Yeah, but I think we came to an agreement that, not everything on the internet is bad. Some things actually might be right, but the most important thing is if you're not in the healthcare field, then you might not best know how to interpret, like you said, the information that you're getting.
Absolutely, because when you're, a practitioner or a clinician is assessing your symptoms and trying to decide what test to order for you or figure out what might be wrong, they are considering lots of things outside of a bubble that you are in. They're considering your family history. Has this happened before? Is it acute? Is it chronic? What medications are you on? What medications are you supposed to be on that you're not taking? That's one big thing, especially if we're going to consider our community. And it happens everywhere, but you mentioned our African-American community is oftentimes when we are feeling a little bit better, we become non-compliant.
Oh, wait, explain.
I mean, for instance, something as simple as, let's say you go to the doctor, and this is not related to cancer, but let's say you have an infection and they give you antibiotics and they say, please take these for a course of 10 days. There is a reason for that. There is a purpose for that. The person after 3 days feels a little bit better and the pills go in the trash. And then they wonder why 2 months later they have a recurring super infection because the first one was not resolved. Well, even in medical care, if we're talking about cancer, people have to be diligent with their doctor's appointments, their testing, follow-up, whatever the treatment plan is, stick to it. Again, no one owes you more than you. You owe it to your own self to be proactive in your healthcare, to advocate. If you feel like the doctor is not listening or doesn't understand, switch to another doctor.
Yes, well said.
Be persistent. Request tests. Find out which tests are, might be good for what you are experiencing, and say to the doctor, hey, I'd like it if you order this exam for me because this is what I am experiencing, and I understand this test will help find out or could help find out whatever my problem is. So, you have to understand
You have
that
to learn your patient's rights.
yeah, and you have to understand that while the
Yes.
medical community is knowledgeable, we don't all know everything. We are learning all of the time. So
Right.
sometimes the doctor and the patient will learn together.
And the medical field is constantly transforming and changing and things. And so the doctors that are coming out of college this year are taught may have learned some things differently than doctors that may have graduated 10, 20 years ago, obviously. And so it's important to stay current, to know your patient's rights, like you just said. I think there's I guess you could call it kind of a stigma in the Black community that you can't challenge your doctor because they must know better or whatever, or ask questions and things, or if they give you a prescription and just take it and you never question anything. And that's not the right attitude to have at all when you're talking about your healthcare.
I think sometimes that comes just from a lack of knowledge. Sometimes, especially elderly African American persons, they want to advocate for themselves. They don't know what to ask or what to say. So sometimes they need relatives to advocate on their behalf.
Oh.
If in fact they share with a relative what is going on, because that doesn't always happen either. So one of the things too, I just wanted to touch on, if that's okay, because I know time can be limited.
Go,
please. If we're talking about health practices, there are the risks that you cannot change, which some of the genetic-based risks that I mentioned before, and then there are what is called modifiable risks, things like smoking, things like eating. We all know that you can either shop at, and I'm just going to name a store, I'm not supporting any stores. You can shop at ShopRite or you can shop at Whole Foods. It's a completely different shopping experience in terms of what you're going to pay and what you're going to get, but we all need to eat. But for as best as you can, a clean diet will help your body systems all of the time. Alcohol, tobacco of any kind, and please, if you know someone who is vaping, stop. Please tell them to stop. But thank you, Terry. But
don't talk about alcohol. Don't talk about alcohol.
I'm over here twisting in my chair.
I'm not saying anything about the companies that make or produce this alcohol. Nothing at all. What I will just say to the buying public who are consuming these products is that alcohol is damaging to your liver, and you need your liver to metabolize all of your medications. So in order for your medications to work, they have to be metabolized through your liver. You need your liver. Protect your liver.
Wow.
It's very, very important. No one ever in early education, within our homes, if you start talking early to your family members about the importance of preserving your lungs, you need your lungs to breathe. If you are not breathing, you are not oxygenating your organs, or there's not good blood perfusion. So if your organs are not properly oxygenated, they are not working properly.
Right.
And it's not like a car. After 5 years, you go buy, your car doesn't work quite well, you just go buy a new one. It's really okay. But your body doesn't work that way. The lungs that you have or the lungs that you are going to have, you might want to be not kind to them. Same thing with your heart.
You got me over here twisting in my chair, scared.
I am kind to my lungs. I don't do nothing to my lungs. But I don't know. My liver and my kidneys might have something to say.
When your kidneys are upset, they are unfriendly creatures. And I know some people think, well, I can just get a kidney transplant. That does happen, and a lot of people are successful, but you'll be on the list forever. Protect your kidneys. And people think in terms of high blood pressure that it only affects their heart. No, your kidneys are very, very affected by high blood pressure.
Wait. I'm sorry. Say that again.
High blood pressure does affect your renal function. Your kidneys are affected by it. So, you have to eat better. You have to exercise. And some people say, well, I run after my children all day long. You are not exercising. Please and thank you. So exercise is important. Eating as clean as you can. You want to cut out the sugary products and the products that are high carb products. Get more protein in your diet and things like that. Some people think that they can do what they want on one end and take a lot of vitamins. That's not necessarily the best thing to do. I had another note because I wanted to make sure that I touched on some important things. And talk to your kids about it. You may think that they don't understand, but you ever sometimes reflect on something that your parents said to you 10, 15 years ago, and I kind of heard that before. Say it to them. They might not be paying you any attention right now, but it could be very valuable information in the future. We touched on earlier in our conversation, we talked about being underserved population, population.
We definitely, I was going to get into that. Yes.
Along with that is being underinsured.
Wow.
Everyone knows that in this country, probably through all over the world, that if you have this level of health insurance, you have access to this level of treatment. And if you have this level of health insurance, you have access to this level of treatment. And I'm going to say that is not an untrue statement. But what I will say is, regardless of what your level of insurance is, be wise enough to take advantage of everything you can get from that. I don't ever want anybody, especially a person who has been diagnosed with cancer, don't ever think there's something that you cannot afford. If you work closely with your healthcare team, your oncologist, they will help you find everything that is available to you or for you that is appropriate for your treatment plan and covered by your insurance. They will work with you. They will not work for you.
Well said, sis.
There's something that is just very important. And we are an underserved community a lot of the time, but two of my very best friends who are also oncology nurses, they are managers actually.
Shout them out.
Latoya Thomas and Angie Bailey. They are in their clinical practice and wonderful people, compassionate nurses. And one of the things we do is anytime we hear about a cancer fundraiser or a cancer walk, we are there. We want to learn. We want to know what the current resources are, what's available to people. The downside is when we attend these events, we are either the only African American people there, or we are of less than 5 who are there. So to our community, I say, I won't say that information is always readily, easily accessible to us or for us, but I'm having a difficult time seeing where we are trying to, get into these events where we can learn more or see more. You'd be amazed at the networking that goes on. And then people go, oh, here's something you can do, or read this article, look at this website. And the learning just goes on from there. But if you are not involved and you do not participate, then there can't really be an expectation that you will benefit from it.
Right. Well said, sis. Well said. I mean, you're giving out so much good information. I mean, I'm hoping people are taking this all in. I want to say this, people. You can comment, send your questions if you have questions. We welcome it. All right. I want to say that. All right. Let's keep this conversation going. I want to say this, sis. When you speak about these things, I can hear the passion in your voice, and I think we all appreciate that. And I just want to acknowledge the fact that when you talk to most nurses or people working in the field, they're all seem to be very passionate about what they do. They're all happy to be part of a team, right? I see that. To be part of a team, helping you help yourself. And that's something I want to say that I think all of us out here appreciate. Thanks, sis.
You're welcome. We have one shirt that says oncology team. They fight, we fight. We can't fight for you, but we will darn sure fight with you.
Yeah.
I'm sure every nurse is a compassionate nurse, but our oncology nurses are so compassionate. We celebrate victories with our patients. And what patients don't always know is when we go home, we're thinking about them. We're concerned about them. When they have a not so successful experience, we hurt when they hurt. It is a very compassionate field. And honestly, you can't be in it if if it's not in you.
Wow. Well said. Well said. And with working in the oncology field, obviously you've seen people pass away, and seen the effects that it has on the families. Would you consider it almost selfish if you're a person, not even necessarily had to be part of a family, and you're not taking care of yourself properly, leaving people with a burden? And I'm only bringing that up because I've seen people who've been warned, for instance, who had diabetes and were warned when they first cut off the toes, were warned when they cut off the foot, warned when they cut off the leg, but yet they continued the bad habits until the day they died, as if they almost didn't care. Is that a form of selfishness in a way?
I cannot agree that that is selfishness only because do I think it's good? It absolutely is not. Sometimes it is fear. People get themselves into a place where they don't know what is going to happen or what is happening to them, and they have no control or little control over it. And so they become afraid, they shut down, and they do nothing to help themselves. It's not helpful to the people that have to take care of you. Caregiver strain is very real, and it's
very real, very real.
Caregivers need help too. So I can't call it selfish, although I can absolutely see why it can be viewed as selfish if you know that you continuing this behavior will lead you down a bad path, and you'll be left as almost a burden to someone else when you could have chosen to do things differently. Not wise, but I've come to a place where I'm learning or have learned that while it's not good, sometimes there are reasons for this behavior, not reasons that are acceptable to me or not reasons that I agree with, but a reason that is meaningful to the person who is experiencing it. And that's what's important at the time. I can't get into their head. I can't walk in their shoes. I am not having their experience. So I cannot explain their behavior. I may not agree with it, but I can't explain their behavior. Kudos to the family members that take on these responsibilities and take care of their family members. I tell all of my family members, please take care of yourselves. I'm a firm believer in nursing homes.
Right. Well, so I guess the most important thing is just not to judge.
Don't judge because let's say, for instance, I come across a patient today and they are 50 years old. I have no idea what they have lived through the first 49 years. I cannot judge. I don't know what their journey was. I don't know what their soul's journey is moving forward. So I don't judge for that reason. I don't know what their resources were, what their knowledge base is. I don't know anything about them except that at this time and place, they have an illness that I need to help them with.
Right. Well, okay. I want to ask you about this too. And boom, you can jump in whenever you got a question or whatever, but I'm going to ask you this too. Getting back to our community and the point of being underserved. Have you ever heard of the term a healthcare desert?
A healthcare what?
A healthcare desert.
What is that? Tell me what it is.
Where there are areas where African community or poor communities, I don't want to say African, but poor communities are, where there's barely and there's not enough hospitals, or they have to travel so far to get the healthcare that they need.
Oh, I have not heard of it with that term, but I am aware that there are communities where they have very little access to healthcare. In fact, there are a lot of studies going on in this country to try to better help those communities. And one of the solutions they did come up with is some of these urgent care centers. You may not
Yes.
have a trauma center or, a specialty hospital in your area, but you may have an urgent care center that can get you some immediate help if you need it. Here in New Jersey, where I live or where we live, fortunately, we don't have that issue. But if you go out to where my son lives, where Julian lives in Arizona, you can travel a little bit to get from one place to another. And even on the road that you have to travel, there aren't many places to stop, or you won't see anything, as a matter of fact. Travel through the desert. So people like that, not people like that, I'm sorry, communities that live that way tend to rely a lot on like the old time at home remedies for stuff.
Oh, wow. You got to be kidding me.
Yeah, people still rely on that because that is what they have. That is what they have access to. But urgent care centers and what they call pop-up clinic or ambulatory care centers, they help in times like that when people have to travel 40 minutes to a hospital.
Right. Okay.
Mm-hmm.
Yeah.
Yeah, it's not a problem here.
No.
It can be a little bit of a problem where my house is in Florida because we have a small hospital near us, but I mean, they can't care for a very sick patient.
Right.
Yeah.
I just want to touch on the mental side of it all. When it comes to patients who might be going through bouts with diseases like cancer, and the toll that it can take on them. My understanding that it's best for people who might be suffering through these type of things to also receive some kind of mental care for their well-being, just as well as the other medical care that they might be receiving, because depression sets in, from my understanding, and that could be just as bad as the actual disease itself. So I just definitely want to touch on that point too. Mental health is very important, and I'm glad to see people starting to take more of a focus on that now. There's a lot of strains that Black women themselves go through in life. Sometimes a lot of Black women are single mothers, balancing jobs, kids, and so on and so forth. And there's a lot of mental strain that goes along with that. How important is it for women to take that time out to take care of their mental space, and like I said, just take that time out to recharge the batteries and take care of that mental space?
Well, caring for the true self, the human being that is outside of mom, dad, wife, employee, caretaker.
Right.
There's a person on the inside, and that person gets lost most of the time. But when people talk about things like work-life balance, that's a real thing. You have to try to find as best you can, and it may not be every day, but you have to try to find some work-life balance to try to maintain your mental health. Now, with respect to cancer, which is what we're talking about today, if you were not already depressed, you will be depressed at diagnosis. Because once the shock wears off, everybody goes into a state of fear, and then not necessarily depressed, but a real state of concern until they can start a treatment regimen. And then, cancer can change your life because the treatment is difficult to go through, but it can afterwards enhance your quality of life. So you have to go through it. Some people choose to, some people choose not to. But in terms of mental health, even outside of cancer, it is important to, as best you can, try to maintain your mental health and to understand that past stigma about mental health, with people saying you're quote unquote crazy, let that go.
Let that go. Right.
People who are brilliant, who sometimes have tough days managing life. They have tough times. COVID put people into a financial strain that some people still have not been able to overcome. Well, what happens when your bills are this high and your income is here? There's a bit of a strain on your mental capacity. So You have to find a way to try to preserve your peace, is what I say. Well, one of the things that is important when you talk about mental health and cancer is that cancer does not just affect the patient. Now, it affects them more because they are the person who are living this experience.
Yes.
The family members who love and are concerned for and are concerned about this patient, they also go through a mental health. I'm a mom, goodness forbid, but if I had a child who was diagnosed with cancer, I probably would have been on the edge of who knows what. It can take a toll on you. So when we talk about mental health, it's not just about the patient. It is about the patient and their entire care team, medically and personally.
I just want to interrupt you for 1 second, Urs, just to recognize on Inez who's joining the conversation, and she could probably speak more on the mental, spiritual side of all of this. Hi, Inez. How are you doing today?
Hello. Please forgive me. I totally I set alarms and things, and I did not do that. So I was ready to sit down and eat my breakfast, and then I saw a message from Shaquille. Oh my goodness! But let me say, Ursula, thank you.
Yeah.
I feel you. I hear you. I appreciate your compassion and your understanding. I can speak only as a non-professional. I guess my qualifications today are that I am a woman. I'm fortunate that I don't have any serious health issues, but I do have a deep interest in health and especially in the body-mind connection.
Right.
You know, so
right. My understanding on Inez is that you also are accepting to alternative of treatments when it comes to diet.
Very much so. Very much so.
That field is expanding rapidly, actually, because many people are understanding that there is a benefit there. There are traditionally a lot of people who have been raised believing that medication specifically, cures all things.
Right.
In fact, lifestyle changes and some more healthy options can actually bring you to the same outcome.
Wow.
I am a supporter of the alternative remedies as well. There are a lot of practitioners who are a little more outspoken about it. It was somewhat taboo in the past, and now the medical field is a lot more receptive to it, especially after COVID. I don't know if you all have seen or read where a lot of healthcare practitioners were saying that in the United States, we are considered an over medicated and over vaccinated.
Oh, I believe that.
There are still there's a lot of discussion going on about it. Of course, some people will and will not agree. You have to decide what is best for yourself, your family, your children, if you are responsible for any. What is important as we talk about this is have a healthcare plan. I'm 54 years old. I'm not ashamed of that. But once you reach my age and even a little sooner, you have to prepare your children for what your wishes are. My children know clearly what my wishes are. You know, if you are a person that appreciates alternative medication regimens better or more, make sure your family is aware of that, so that if you are ever hospitalized, you have an advance directive medical plan that says to the medical community, if I am not able to advocate for myself, these are what my wishes are, and this is how I would like for you all to proceed. The
Wow.
first
Well
thing that
said.
happens when we admit a patient into the hospital, one of the questions is, do you have a medical proxy? A person who can speak on your behalf if you are not able to, and that person is actually going to advocate for the things that you want, not the things they want for you.
Right.
We also ask if you have an advance directive. If you have one, have it typed up, have it signed, make it a part of your medical chart at your local hospital or your doctor's office, or make sure it's available in the event you have to be taken to the hospital, because you don't want to get to the hospital and feel like things are happening to you or your body that you're not happy about or you don't approve of. And when you're hospitalized, that's not really the time to learn about what you want, because when you're sick, you're not receptive. And if a doctor comes in and in 5 minutes tells you 1,000 things, you're going to hear 2 of them and miss all the rest.
Mm.
It's just the nature of the beast. So it's important to outline in writing what your wishes are,
Right.
especially if you're a person that appreciates alternative medication like myself.
Right.
Yeah, I think it comes, really even before that, it's really just about the mind-body connection.
Okay.
That you understand that, like you were talking, Shaheem, about the person who has diabetes and who's getting their foot cut off and they still seem to be doing anything about it. Well, that person's already down a slippery slope. That person may, and this is, again, I'm not a professional, this is just my intuition, that says that person may be going, yeah, oh, you took my foot, I ain't got no more to live for. So if you then take my other foot, I'm just going with it.
Yeah.
Because that's already the slope I'm on, you know. And it may not be fair to people, but I have my doctor.
Right.
And I have my alternatives,
Well, let me ask you this on Inez. When you tried to talk to your doctor about using some of these alternative methods, what was his reaction? Was he receptive to it?
Well, I don't necessarily, so let me try to think. So my most recent thing is that sometimes I will get what medicine calls sciatica, and that's what it is.
Right.
But I know that like I could tell my most recent flare up, and it was severe, had its origin in my mental state.
Oh, okay.
I understood that. So now, but what I did, because it hurt so bad, I ran to my doctor, and they gave me, I was going to say a bunch, not true. They gave me 2 medications.
Okay.
I came home, I took those medications, and nothing happened. Nothing happened. No, I was still in severe pain.
Okay.
I called them again because I'm in pain. So I'm like, stronger drugs, please.
Okay.
Well, they don't get back to me for a couple of days. So I finally get into what I know about how to cure sciatica. And that is, I read my book called Healing Back Pain by Dr. John Sarno. And when people, it has been reported for thousands of people that they read it and they're cured, because what it's doing is it's informing you, honey, not that it's in your mind, but that your mind is the cause, or what's happening is that you're saying my issue is too frightening or painful, or I'm too angry and maybe it's not appropriate, and if I let my anger go, I'm gonna hurt somebody and then they're gonna hurt me, and so the pain is to say, oh, my problem is my pain, my problem is my pain, my problem is my pain, and not deal with the problem. That's the problem.
All right.
So you educate yourself and you say, my problem, he says, if you you get a spasm or whatever, you say, all right, brain, I know what you're doing and it's not going to work. This is emotional, psychological. This is the fact that I'm struggling financially right now. That's what this is. So I'm just going to keep telling myself, you're struggling financially. You're struggling, or, you're afraid. You're afraid. So,
yeah.
And then, so anyway, then it went away. I didn't have to, when I went to the doctor, I did say to him, because by the time I went, I had gotten past the problem. So I went the first time, I got the drugs didn't help. And I told them, I'm okay now, and they said, no, come in anyway. So I went in, and I told them what I thought it was. I said, my understanding is that this is mental emotional, and I'm past it right now. I'm past it at this moment, And I think they kind of agreed with me. I don't think I got any argument. Certainly they couldn't say, they understood that, I didn't need any x-rays. Some people were like, get x-rays, make sure. I'm like, I don't know what this is. I don't need an x-ray,
I have heard of that. I think that I have heard of that, and I do know that it's more of a spiritual journey for people, and it has to, in order for you to actually benefit from it, it has to be something that you practice and believe in. So for persons involved in that and who study that and practice that, it is helpful for them, and they do avoid some medications. But while I think that's a wonderful thing, it's something that I appreciate. I have to say though, if a person is experiencing something that is new to them, they should certainly still be diagnosed. And yes, the origin is oftentimes emotionally based.
Yeah. Well, like I said, I haven't fired my doctors. I have my health plan. Going to the doctor is extremely affordable, as in no co-payments.
Right.
I think that's. I go to the doctor. I think
that's the most important thing, because I just want to start rounding out this conversation because we're coming to the end of the show. But I think that's the most important thing, and I think that should be the message for the day. It's most important that we have a healthy relationship with our healthcare professionals, be it man or woman, whoever they are, or whoever you are, and most importantly, I think we can all agree that the biggest thing for everyone is to change our diets and just make sure that we're eating a healthy diet and consuming enough water, and that alone can benefit us immensely.
Diet, exercise, and preserve your peace.
There you go. Diet, exercise, and preserve your peace. That's going to be the last word of the day. How about that?
I love it.
All right, I want to thank our guests for giving us all this information and helping us have this great conversation today. I want to thank my sister Ursula. Thank you very much, sis. I really appreciate you. Love you to death. I'll be talking to you soon. Thanks for coming on. And to Aunt Inez, thank you for your commentary, and thank you for joining the show. We really appreciate having you.
For being late. We're going to have to answer to my sister.
That's all right. We forgive you, and we're just happy that you were able to join the conversation. Thank you to both of you guys.
Thank you. Bye-bye.
Bye. All right, guys. It's time to start rounding out the show. Boom, you there?
I'm here. I ain't never go nowhere.
I know that you didn't, because you are the hardest working man in the business, and you can definitely do two things at one time. What you got coming on, guys?
Man, listen, I actually moved on Wednesday. I got my house. I moved on Wednesday, so I'm excited about that right there. Um, and then, of course, this week I'm back here at Catch the Kitchen and Cocktails every Saturday and Sunday from 1 to 5. R&B brunch. As y'all can hear,
Right.
we have
That's
a good
right.
time in here. So that's my calendar for this week. We're not gonna talk about next week.
Yeah, I know you stay busy, man. You're doing your thing. Congratulations for everything that you got going on, cuz I just want to say that. And as far as me, folks, before I jump into what I got going on, I just want to say this. Our cousin, our son, has his own clothing line, folks. And right now, the weather's getting a little cooler outside, even though it was warm yesterday. It's getting cooler outside. You might want to go ahead and get them varsity jackets, and he can get them done for you, folks. So reach out to our cousin at Tailor Made and get those varsity jackets made up, folks. It's that weather for it. Trust me when I tell you, it is definitely going to get cold. And also, on top of that, do not forget, along with everything else that I got going on, don't forget Hazy Trays. Custom image tray sets, folks. They make excellent gifts, and we're also going to be providing other things on the website. So go to hazytrays.com and make sure you pick out something nice for that special someone in your life. And also, while I'm talking, I can't forget to say, for everything that's got going on with Shyheim, me, go to therealshyheim.com and you can hear my latest music and everything, and one is about to drop this week, and everything that I have going on. And there you have it, folks. My sister did the last word. So Boom and I are going to start running up the show. Boom, you got anything you want to say?
Listen, man, y'all need to take y'all health seriously, men and women.
That's
Don't
right.
hold out. You start feeling aches, pains, things that you know you didn't feel before. Go for it. Go to the doctor. Find out what's up, and like Cuz said, ask questions from start to finish. Don't just let them tell you what it is.
Yeah. And in fact, we all struggle with health, especially when it comes to diet and things like that. All of us do. We've all had issues with it. So I mean, maybe we'll start sharing our struggles with it. Right now, I'm having struggles with trying to lose weight in my diet and everything. So maybe week after week, day after day, or whatever, when we come on the show, I'll share my journey with you guys. How about that? And we can walk this thing together. But most importantly, take care of yourself, folks. If you want to see you back here next Sunday for the next episode of From the Shore to Be More. All right, everybody, ladies and gentlemen, everybody, enjoy your week. We'll see you next time.